Hello everyone, this is Deb Siriani. I'm the director of the Senior Center in Chelmsford here, and I'm the co-chair of the Age-Friendly Committee in town. And with me today are Lisa Marrone, who is also on the Age-Friendly Committee, and the Business Development Director in town, and Jen Melanson, the Community Community Services Coordinator, and also on the Age-Friendly Committee. So we welcome you to today's show. We'll be doing a monthly show about age-friendly initiatives in town to let you know what's going on. Today we are focusing on the community supports and health services, which Jen is leading this part of the age-friendly domain. So Jen, we have lots of things going on. Lisa was going to ask you, I think, a little bit about one of the first initiatives we have going on right now that's very timely.
Yes, right.
Right?
So I know Jen and I, we overlap. All of our efforts overlap,
Yeah,
either municipality or age-friendly Chelmsford as well. And we talk all the time. So I really appreciate the collaboration on it. But you're really taking on the bulk of the, this is tough stuff. It's not easy to do for first time out.
Yeah.
But if you could share a little bit about how you've been working in terms of community services and provisions and for transportation.
Yeah.
I know you're trying to get a whole new program off the ground.
We are, and we're just about ready to launch. So this has been an effort that's been years in the making, and I have to give credit where credit is due to Mr. John Bowles, who is also a part of our age-friendly committee. He's the one who's really spearheaded this whole project from the ground up. And so I really joined kind of in the later stages, and I consider myself more of a support person than anything else. So just about a year ago now, we were awarded a portion of ARPA funding by the Select Board in order to get this program off the ground. And yeah, Lisa, as you said, it's been quite an undertaking. And it's not an easy thing to start a program like this from the ground up, even when we're modeling it after the transportation service that's provided by the senior center, And so we have a name. We're calling it the Chelmsford Ride. And we actually have a transportation coordinator now. Her name is Cindy Purnett. She's a lovely young woman, and she's going to be doing all of the behind-the-scenes stuff, scheduling rides for folks, but also marketing and recruiting of volunteer drivers and that sort of thing. So essentially the program is a volunteer driver-driven program where volunteer drivers will be provided with town vehicles to drive residents to appointments and for errands like grocery shopping and pharmacy runs, that sort of thing. And this service will pick up kind of where the Senior Center's transportation service leaves off, starting at 2 o'clock in the afternoon, and will run till 6 p.m. Monday through Friday, and will be open to all adult ages. So that's kind of the exciting thing about this program, is it's not limited to seniors, because as we know, our age-friendly initiative is to make Chelmsford a livable community for all ages.
Very true.
So we will be looking to provide transportation assistance to all adult age folks in town. And we are actively recruiting for volunteer drivers now. So I believe Pete is sharing our volunteer driver recruitment flyer as we speak, and the information is there to be able to reach out to Cindy, our coordinator, if you're interested in being a volunteer driver. There is no cost involved to the volunteer drivers. They are required to provide to submit to a query check and also provide a copy of their driving record, which costs a little bit, but the program will reimburse them for providing that. And then they will receive training through us and first aid and CPR certification, and a whole host of other things.
There's so much information there. I had questions, and as you kept talking, my questions kept getting answered and answered. But when you think about the age-friendly program and livable, transportation is like top of the list.
Right.
Top of the list. It really helps with the isolation and just inclusion and social. There's so much to the other domains. You've really done so much work, and one of the questions was, how does it differ from the other transportation program we have? And it's an extension of it, really.
Yeah, this is meant to be a supplement. And I
yeah.
should mention, too, that volunteer drivers who are meet the eligibility for the senior tax credit work program can use this program to work off hours towards that.
That's
as
just
well.
fantastic.
And you can get up to $1,500 off of your taxes per year now.
Right.
With that
for
program.
driving. How many hours is it in the year?
It's 100. It's close to 100.
Yeah.
Anyways.
Yeah.
And so back to the beginning. So so you're looking for volunteer drivers.
Yes.
They don't have to be Chelmsford residents.
They do not have to be
Okay.
Chelmsford residents. no.
And do they just reach out to you to get
Yes,
enrolled?
so they'll actually reach out to Cindy, whose information I believe we should have on the screen.
Okay.
And Cindy will take
Yeah.
care of doing the enrollment and going from there.
Yeah. That's partly why I never see you. We always talk on the phone. You're always on the go,
Yeah.
trying to coordinate and do these heavy lifts of things. And John, his whole background is transportation.
Yeah.
We really have a phenomenal team of volunteers that have come together to help us become age-friendly. And as on the previous show with Paul, town manager, we achieved age-friendly years ago. We're in the phase of actually implementing the action
The
of
action plan.
doing that age-friendly steps. And I think this is just going to be a spectacular service for the town as people can age in place,
Right.
right? And it takes a lot of help off of families as well, trying to make sure that people get to their appointments and important things. So thank you so much for doing all of that.
Yeah. Well,
Really
we're
looking forward to
Happy
it.
to do it. And, as an office of one, I am really reliant on volunteers.
Yeah.
So I appreciate those who step up and help with these types of programs.
And using municipal vehicles. So it's their
Not
time.
vans, just so you know. You don't need to drive a van to do
Okay.
this. You can just drive a regular car.
car.
Right. This is a car
A
service.
smaller, like
So-
sedan type car.
Yes.
Yeah.
Is provided.
Yeah, so you don't have to be similar to driving your own personal vehicle.
Yep. And the rides are, how are we, we're going similar to mine, right? So the Chelmsford Senior Center does to Lowell and to Chelmsford and to Westford. Is that similar? Did we decide?
Yeah, we're expanding a little bit because we'll also go to essentially any town that touches Chelmsford. So you can add Tewksbury and Billerica and Tingsboro to that list. And then we also will do hospital trips to Leahy Clinic, the Bedford VA, all Lowell hospitals, and then Emerson Hospital in Concord as well.
Excellent. And those are things that we're not always able to do.
Right.
Because we have so many other things,
Yeah.
that we're trying to get done during the day in the social day transport. So this is really great for us because then we get to say yes to more people,
Yeah.
which we
Yes.
always
And the
love.
other thing is that they don't have, people don't have to be concerned about how to figure out Uber and how to figure out Lyft and
Yeah,
using
there's-
your smartphone
There's
and all
no
that
apps
technology.
involved. If someone needs a ride someplace, they pick up the phone and they call Cindy,
yeah.
and Cindy will schedule it for them. Or
A
they can
real
send
person?
her
A
a
person?
real
On the
person,
phone?
yes. Or they can send an email if they prefer. But yes,
Yeah.
Yeah, that's great. That's great. Thank you.
Thank you so much for doing all that hard work. And then that's just one of the list of many of things that you've been doing working on. So, Debbie, do you want to lead into some of the other topics that have
I
been
know that
ongoing?
there was one very successful program that people don't realize was part of your age-friendly domain. And that was the Grow a Row program this past summer and the Gardens for Good.
right. And
wanna
Gardens
highlight
for
that?
Good I feel like is my baby project, because it's the very first project that I implemented when I first got hired here in Chelmsford.
Yeah, I remember
So, so I hold that very, dear to my heart. But yes, it is an age-friendly project, and it came out of actually the 2019 Greater Lowell Health Alliance Community Needs Assessment, which identified that, surprisingly to me, Chelmsford residents identified increasing access to healthy foods as a top priority in the community.
And that was before all of this.
And that
all
was
of these
before the
raised
pandemic.
prices.
That was
Yeah.
before the pandemic and before all the inflation
big now.
and all that sort of thing. And I say it was surprising to me because when you think of Chelmsford, I think you don't automatically think of a lot of people struggling to put food on the table. But food insecurity is very real here in Chelmsford. And then certainly, you know, whoever knew that a pandemic was coming, the summer of 2020, that growing season was our first season with the gardens, and it was just so incredibly timely. And so the gardens have undergone an expansion since they were first built. We went from 6 raised beds to a total of 14 raised beds out in the back parking lot behind Town Hall. And what makes this project different than other community gardens is that it's not limited to only the folks who are able to physically grow in the plots. So in other words, most community gardens kind of set aside plots for people to do their own growing. With Gardens for Good, we do the growing for the community, and then we distribute the produce to whoever is in need of the community.
And again, a lot of folks who help you with the gardens are senior tax workers.
Exactly.
So another program that is helping seniors.
Yes. Again, we're incredibly
stay.
reliant on volunteers for this program, and we have folks that come in all through the season that do everything from garden maintenance to picking for us to distributing of the produce.
And then bringing them to the table of plenty, right?
Yes, yes. So this is where in the second year we were able to combine efforts, and again with John Bowles, who's just incredible, and started this Chelmsford Grow a Row program where backyard hobby gardeners in town were encouraged to set aside a certain amount of their space to be able to grow some produce to donate to the program. So there's been tremendous response to that. So that produce that comes from that program is combined with the produce that comes out of Gardens for Good. And then we're able to distribute to 3 different places twice a week. So we distribute produce to Table of Plenty, which is a community supper that happens on Tuesday evenings at the Senior Center. We also distribute to the Chelmsford Food Pantry. And then 1 day a week, we distribute through the Housing Authority, either through, we've done mostly senior housing, but we have expanded into other housing within the Housing Authority as well.
And that's important because a lot of the things that are available through the pantry are dry goods,
Exactly.
and canned goods, and these are beautiful, fresh, organic,
Right.
garden produce that's so healthy for people.
Right, and also is so expensive, for folks that are going to the grocery store and buying their groceries. Produce is one of the most expensive items that you can buy, fresh produce. So not only are folks able to access this produce for no charge whatsoever, but it's incredibly fresh because most of the time it's coming out of the ground and going home with people same day that it was picked, or at the very most the day after it was picked. So just unbelievably fresh and nutritious.
It's been amazing.
You're doing farm to table.
Exactly.
Exactly. And speaking of table, the Table of Plenty,
Right.
they bring it to the Table of Plenty.
Yeah.
Lisa, would you mind telling folks what the Table of Plenty is?
So the Table of
don't
Plenty,
know.
as you touched on, is the community meal on Tuesday nights. Has been going on for how many years, Debbie?
Oh, gosh.
long time.
I mean, they've been at the
Decades.
senior center for
Oh,
just a
gosh.
few years, but they were at the church, the Congregational Church in the center before that.
My understanding is they started out rotating churches. It started out as a group of churches in town that got together, and they rotated in their church basements, serving each week. But then they quickly outgrew that.
Oh, yeah. Now
And that's all
we're
ages. That's a
serving
meal for all ages.
all
It's
ages.
a community meal every Tuesday night between 5 and 6. It's now housed at the senior center every Tuesday.
Right.
And
And no
you-
questions asked.
You don't, no questions, no money asked for. You can donate if you like. There's entertainment. People serve you. There's dessert. They're just wonderful
Yeah.
people. And there are great opportunities to volunteer for them. And it creates just a community space for people to enjoy a meal and be social together.
And they're averaging, I think, right now over 100 meals a week of what they're serving just in person, and then
Oh, way more, yeah.
as well as packaging up and sending out meals to Meals on Wheels, and then even I have a few homebound clients that I pick up meals for every Tuesday and drive around and deliver to them. So,
Yeah. I think it was over 150 last week for sure.
Yeah.
And they're delicious. I mean, I just hear people just raving
Yeah,
about
everything's
them all the
home-cooked.
time. So all ages are welcome, and it's just a beautiful community event. So what else do we have? Oh, Jen, you're the co-chair of the where do you get all this time?
I know. That's what I'm saying.
You're the co-chair of the HD
by the way, I gotta
Resource.
go.
The Hoarding Disorder Resource Network. So at the
Yeah.
Senior Center, we started a program called Buried in Treasures. And we have support groups, workshops for people, a series of workshops for people with over-cluttering issues or the need to organize better, or all the way up to folks who might experience issues of hoarding disorder. So through that, and with the success of that program, came a resource network where we pulled together other towns, right?
Yeah.
And you're the co-chair of that.
Right.
With April Hunt,
With
yeah.
April Hunt, who really, started this whole initiative. It's a huge passion of hers, and I feel very fortunate to be able to be involved and to be doing this work with her. But so I've encountered in my work, and also through my collaborative efforts with the health department in town, quite a few number of folks in town who have this overcluttering, hoarding issue that actually places them in danger of losing their homes. And again, we know that the Age-Friendly initiative is all about keeping people in their homes. So, oftentimes people think of hoarding and they think it's synonymous with laziness. And so one of our real big efforts with this new task force is to really dispel myths and to bust the stigma of hoarding, because it's not about laziness at all. It's actually happens most often because people get into situations that are overwhelming. And we see it frequently. The majority of people who fall into this category are actually seniors. And we've seen them that they've been living in their homes for a long, long time. They've accumulated all this stuff, and then they develop mobility issues or they develop health issues that prevents them from being able to clear out their home. And they need some help.
Isolation.
And isolation. And of course, the pandemic didn't help, right? Everybody, I don't know about you guys, but I had Amazon boxes coming to my house almost every day.
I still do. I didn't have to get back home.
And so, there was more stuff coming in during the pandemic and less stuff going out. And, so the pandemic, and then with the isolation factor with the pandemic certainly has heightened it. But so what April and I have been able to do with this task force is we've actually combined efforts with 8 other communities. So there are 9 communities involved in the task force, and we've formed a resource network so that we can provide needed resources to residents who are in need of some help with this so that they can stay in their homes. And the efforts are far-reaching because they're not just for us to provide resources to residents, but they're also for us to provide community education and supports, particularly with education with our first responders, so that they know sort of what a situation looks like when they're going into and how to handle it in a way that's sensitive to the individual that's living in their home, that isn't shaming or judgmental, and then also being able to provide those first responders with a first contact person who can actually come in and help the individual with their cluttering situation and to be able to get things to a point where they can remain in their home. So it's a really under-resourced area. One of the things that was surprising to April and I when we were April really predominantly wrote a wonderful grant that we were awarded from the Greater Lowell Health Alliance. One of the things we were surprised about was that there are not a lot of statistics on hoarding disorder and sort of the amount of money that it costs if somebody is in danger of losing their home to be able to keep them in their home and that sort of thing. So we'll also be tracking that as well, and so that we can generate data that will help inform the task force moving forward.
And the Board of Health have been a great partner in that too with us.
They certainly have.
The great thing about the age-friendly effort is it's brought so many of us department heads working together.
Right.
And we're realizing what, like I know what you're up to, and
Yeah.
I know if somebody needs something, I can send them to you. Or if I feel like there's something we could do together, it's brought us all to share resources with each other and assist each other in a way that's a lot more efficient,
Yeah.
I think, than other towns are able to do.
I think
And
that's a
I'm just
unique
so
thing to
thankful for that.
Chelmsford in general, is how collaborative the town departments, collaboratively they work together.
Yeah, I have to agree. I think the age-friendly program on a bigger picture is 8 domains. Jen has taken on the community and health services, but that's in addition to the long list of everything else you're doing. So it's pretty extraordinary, and you're doing such important work. Just those 2 main topics, the transportation and the buried in treasures, and then also, the food insecurity. These are all really important things that set our town, create that identity of what we're all about, and why businesses may locate here, why people want to move here and stay here. I think the work is really important. And if you look around the state, it's not something simple to do to become age-friendly. It typically takes 2 or 3 years to fully implement that, and we've been at it for a little bit, and for a while we had about 40 volunteers to help us get going with some of this, and now we're an appointed committee. And I just kind of wanted to point out that this work that we're so busy doing is really making a difference.
Yeah,
it's really making a difference in people's lives, and I know that the families are really appreciating everything that you do.
And a shout out to the businesses in town too, who have supported all of these efforts. I mean, the Gardens for Good expansion was made possible in large part due to a business in town making a sizable donation.
Yeah.
And we've had businesses make donations to Table of Plenty and to the food pantry and all of that. So kudos to the businesses
And
as
it's a
well
little
who
bit how
support
we
the community.
overlap.
Right.
Why we work so closely all together, business development and senior center, but there's just so much work that we do that we're here to serve the community. So it's
It
something
feels
that
good to
really
be
works
part
well.
of it. It really does.
Yeah.
It does.
Absolutely.
So we have just enough time. We don't even have time to cover everything, I think, that we had on our list because we're doing a lot. But we'll be back. We'll be back next month.
Monthly
Stay
show.
tuned. But one last thing is the partnership with the Chelmsford Police Department, and they're offering a safety net bracelet program. Do you
Yeah.
want to tell a little bit about that? We have about 2 minutes, so
Yeah.
unfortunately we'll keep it tight. But
So this is a program that provides tracking bracelets to wanderers. So wanderers can look like seniors who maybe suffer from memory issues, but also we've had a successful run with a child with autism in town who has received one of these trackers as well, who is a habitual runner, that has made things much safer for the family and much easier for the police to be able to locate this person. So the way it works is these bracelets work by radio frequency, which is different than GPS and actually is more reliable, because when you get into heavily wooded, dense areas, GPS, oftentimes the signal doesn't track, but the radio frequency does. Our police department has been trained on how to use the equipment, and I believe even obtained their own tracker. And then they obtained a number, through some funding opportunities, obtained a number of bracelets that can go free of charge to...
with the support of the town manager, right?
And yes, with the support of Paul Cohen as well. So folks who are interested in taking advantage of that program can reach out to the police department for more information.
And we have a series of them that are available for free, actually, through
Yes.
that granting.
Exactly.
So reach out to the police department business number, and that is, without my glasses, 978-256.
2521.
21. So anytime you have any questions, give us a call. We're on the town website. Jen's office is available all the time. Lisa's office is available all the time. We're at the senior center here, and we can answer questions about all of these programs for you. And so just pick up the phone or email us. And we hope to see you next month. We're looking forward to sharing a lot more of that's going on. Thanks so much. Have a great day.